Good afternoon, ladies and gentlemen. My name is Mike Weber. I'm the Public Health Director for Josephine County. So we've invited everyone to come out today because we're going to talk a little bit about COVID-19. Before we really get started, I do want to let everyone know we have not had a positive case yet in Josephine County. I know calling the press conference, that kind of set off an expectation that that may be the case, but we are still considered low risk. However, there's a lot of things going on, not just in the world or the country, but throughout the state. Given the recent changes in executive orders that have come out of the governor's office and notifications that have come from OHA, we want to give everybody an opportunity to engage with public health, our public health partners, as well as we've invited school district to answer any questions that may have come up. So today we have with us representatives from public health, Asante Three Rivers Hospital, AllCare, Grants Pass Clinic, Siskiyou, and District 7. So with that said, we have something coming from Three Rivers.
Good afternoon. My name is Holly Nickerson. I am the Director of Quality for Asante. Asante is working around the clock to ensure those needing care are safe and to those who are providing the care are protected. We are focused on partnering with those who are standing around this podium to ensure Josephine County knows that the local healthcare community is actively making the right steps to pull together teams to mitigate risk for this community. Asante has pulled together numerous teams in support of this. We are looking at every aspect of our daily operations, our ongoing operations, to ensure that we can mitigate any risk to our patients, this community, and our staff. What we want to ensure the community is that we are here, and our goal is to ensure we continue to provide the highest level of care for this community. To do that, we have a couple asks. One, we have limited visitors to one per patient. We ask that if you have questions or concerns, you seek out information on our asante.org website, and also ask that if you are feeling ill, you have cold or flu symptoms, that you call or try to contact us before you arrive. Asante Three Rivers Medical Center is here and is taking action to keep this community safe and is prepared for the challenges that may come ahead. Thank you.
Allergies. All right. So thank you very much. Josephine County Public Health is doing a number of things as well to ensure that we're trying to support the efforts from the governor's office and OHA to increase social distancing. We are having individuals that are coming into our WIC clinic do a lot of their appointments remotely. We're trying to minimize the amount of time that people spend within public health, tightening up appointment times. We're also working with our partners to ensure that they have the resources they need. So partners in the medical community in particular will be able to request resources through Josephine County Public Health up to the state. We also have partners in the community going above and beyond to support us. One of those partners, who we purposefully will not name, is conducting sampling so that small clinics don't have to take on the burden of collecting samples from individuals, their patients. So that still means that all testing for COVID-19 has to go through a provider in the community. You can't, please do not come to public health, and you cannot go to another provider and simply get tested. This is something that needs a doctor's orders. So with that, we're going to open it up to any questions for myself or any of our partners that we have here. Yes, sir.
Is it a little misleading to talk about no one's contracted the coronavirus without telling us how many people have been tested?
So the reason why we don't provide information about who or how many people have been tested at the county level is because it's incredibly small numbers. And at those small numbers, there's the potential of identifying individuals. So the release of private information is a concern for us. The state asks that we don't share information until we have above a certain number. And this isn't just true for clinical testing. It applies to everything from vital records to other things that we do within public health. Those numbers are available at the state level, though. Any other questions? Yes, sir.
This one's for Sherry Ely. As far as with the schools closing, what plans does the district have as far as how students will stay up to date on their learning? Like, will there be any form of homework sent home with students or any way they can do online learning or anything like that?
Yes.
So we are in the process of determining what type of online education that we could provide to our students. As you guys know, this has all happened really fast. Yesterday we were notified that we just had to cancel large groups, and then this morning it was you're canceling school. So we are in the process, and we do have some options. Google Classroom is one of them that we're looking at. We're not prepared at this point to do a full online education for all of our students. We have some concerns about kindergartners and how that would play out, especially for the little guys. And so, like I said, totally in the process of planning out. Probably we'll spend this next week and into spring break firming up those plans in the event that the closure goes beyond the 31st of March. So if it does, then we would start rolling out some true online education options.
Okay, so I guess a follow-up with that. So next week, obviously that's not when spring break usually would be. That's just would be a school week. So that essentially is going to be a week off, and there isn't going to be really any learning during that week. Is that right?
That is correct, yes, unless parents, did some optional learning with their kids. Each of our teachers have some things on their websites, just as resources for parents, and so next week, any type of education would be really up to the parents.
And I guess follow-up that's also related to schools. As far as workers, in what capacity are staff going to be working at the schools over these next 2 weeks?
So we will have, the district office will remain open, so all of the, business and operations functions from the district office level will remain just as usual. Our administrators will be in the buildings, and so if there are any questions that parents or the community have, they can reach out to our administrators. We're providing food service, so we'll provide breakfast and lunch to all of our families, and we've posted all of that on our websites. We have maps at each school, so we'll kind of do like drive-through, school drive-through, breakfast and lunch. So they'll come through and they'll get a lunch and then a breakfast for the next day. And so obviously we'll have our food service workers there. We'll have custodians at each location doing deep cleaning, and then our transportation department, we won't have anybody on site because obviously we're not transporting students anywhere, and then the rest of our certified and classified staff will not be in the buildings.
Okay. And one more question, and I'll let someone else go if they have a question. But as far as maybe those any employees that are hourly workers, is the district looking to compensate employees who would have been working and then now have this time off where they're not going to be making any money because they were an hourly worker? Is that something the district's looking into in any respect?
Yes, none of our employees will lose wages during the emergency closure. In each of our collective bargaining agreements, we have provisions for emergency school closures, just like for a snow day. And so we'll treat this exactly the same. And so our classified employees that do have to come in, like our custodians, we pay them an additional stipend on top of that so that they're compensated appropriately. So no one will lose any wages.
That's all I have.
Okay.
Thank you, Sherry. So, are there any other questions? Yes, sir.
Does the county feel as if it has adequate number of testing?
So I want to I'll need to clarify something on that, a little bit of the technicality on how this is conducted. So we would like more testing available. We recognize that there is a shortage of testing, and this isn't just for our community, it's across the country. But there's two pieces of that. There's how the samples are collected, which we do have supplies available. It's a fairly common sample collection process, and most small clinics can do it if they have the supplies on hand. The testing itself is really conducted two different ways at this point. One, it can be tested through the state, and there's a number of labs that can help us execute that. That requires you to meet specific CDC screening criteria. In order for you to go through that, you need to get the sample collected, and it has to be approved from the state. And if you don't meet those approvals, the sample will be discarded. However, what recently became available just in the last week is private labs are starting to pick up testing capability. And for those, it doesn't require any approval from public health or the state in order to get tested. It's simply your physician putting it in order just like they would for any other test. As more testing becomes available in the private sector, it'll help alleviate the burden on the state and federal resources.
The county has no obligation to test through the state system and through a private lab.
Well, for county testing, we're a branch of OHA, so which is the Oregon Health Authority. So for OHA, we have to use their resources. That may change in the future, but for the time being, that's the way it is. Any other questions?
I'm sorry, you said as more testing becomes available, I'm sorry, I missed the end of that.
As more testing capacity becomes available, it may change who we're utilizing as resources. Something to keep in mind is this is a very, very new disease. And the fact that we've built up testing capacity to this level this quickly is actually quite impressive. We're leagues ahead of where we were not all that long ago. Any other questions?
Just one more. So in the next 4 or 5 days, 2 weeks, how much do you expect testing to increase around here? Anybody?
Unless somebody else has an answer for that, I don't have one. Would you like to speak to that?
I want to talk about this a little bit. I'm David Candelaria, Josephine County Public Health Officer. I like that Mike clarified the distinction between testing and sampling. And right now, testing has been very limited in capacity, and that has driven, I think, in part, the criteria for testing, because the goal was to determine the result of people who were most at risk, people who clearly needed a diagnosis to receive the best care. With commercial labs coming online, their capacity likely is low currently and will expand as time goes on, but I don't know how quickly. So that's the testing side. The other side is the sampling side. So the sampling is basically a big Q-tip that's put in a solution, and that kit, that sampling kit, is sent for testing. The sampling kit is fairly straightforward and fairly available, but with the shutdown of manufacturing in China and other places because of the spread of this disease, the availability of sampling kits is also threatened. So there conceivably could be a point where we may have enough testing capacity, but we don't have the sample kits. I think this two-edged attack on the availability of testing in general means that not everybody who wants a test can be tested. And so even though testing capacity will increase with commercial labs available, there still needs to be a clinical evaluation and decision-making to do testing appropriately, because supplies are not unlimited. Make sense?
So can our country make sampling kits rapidly? They sound pretty simple.
I don't know the details, but the answer is it depends.
I'm Dr. Krista Miller. I'm from Siskiyou Community Health Center, Chief Medical Officer at that clinic. I also want to bring up the fact that the reason we ask people to see and that people have to see a medical provider to get tested is because we have to consider whether that test is going to be useful in that case. We talk about private labs and the increased capacity to do testing, but that test is going to take 3 to 4 days to come back. So if I swab someone today, I'm not going to know the results for 3 to 4 days. And for people who may be otherwise young and healthy, at low risk for getting serious disease, the usefulness of a test is not high. What we are telling people when they are calling our clinic, or if we have people who happen to come in, is to go home, take care of yourself, watch for severe symptoms that may mean that you need to be evaluated for complications, but stay home.
Has anyone that's come into Siskiyou Community Health been tested?
We have seen lots of people with upper respiratory symptoms, which is typical this time of year. I don't want to give out specific numbers. Again, we're a small community. We have the capability of doing testing, but there has to be some clinical decision-making to make that, to see if that's useful. And that helps conserve the resources when we do need them for people who absolutely need the test to determine the best course of care.
But it's fair to say people are being tested.
People in the community are being tested, yes. And the test is a reportable test to the health department.
Yes,
So,
possibly.
if results are positive, the health department is notified. Okay.
I'm Dr. Spencer Countess, Grants Pass Clinic. At the Grants Pass Clinic, our major effort has been to try to triage people and assign them risk before they reach our building. Our Facebook page, our website, grantspassclinic.com, both have our testing criteria and our screening criteria. And our goal is if people are sick, but not so sick that they need to be in the hospital, we'd like to keep them at home. One of the other problems with this viral infection at this point is we have no effective treatment that's specific for the virus. So while we would be happy to test lots of people, we don't have anything to offer them when they have it, other than treatment symptomatically to support them through the illness. And so treating people, as Dr. Miller said, treating people just for the sake of knowledge is nice, but we don't have enough test kits to do that. In addition, to properly connect or to properly perform the test, the person obtaining the swab, which is a 4-inch thing stuck into your nose, it's not pleasant. The person doing that is supposed to be wearing a face mask, a breathing mask, eye protection, a cap, a gown, and gloves. We simply don't have enough of those supplies, nor do we have enough of the testing medium to perform that on everyone we would like to. And our supplies are being allocated, and so we simply aren't going to get as many supplies as we want. And because of all those reasons, we have to strictly limit who gets tested. And so again, our goal is to keep people who are sick out of the building until we can do something about it.
This has to come down. I'm Dr. Kelly Burnett. I'm the lead medical director at AllCare Health. I just wanted to address AllCare Health is we're the CCO in Josephine County, and we also represent parts of Jackson County, Curry County, and Southern Douglas County, as well as we have Medicare Advantage members as well. In terms of coverage, the testing is covered. Treatment is covered. Both the Oregon Health Authority and CMS, which administers Medicare, have been very clear for that. I can't really speak to private insurances, although a number of them have opened this coverage, but if you are privately insured, I would definitely recommend double checking that because for the private labs, I think there's not a lot of transparency yet about cost of testing. as well for our high-risk members or patients who may have underlying respiratory illnesses, things of that nature. Certainly treatments for those conditions which may be affected by the coronavirus, would be covered, and have made access, similar to during the wildfires when people had greater incidences of those illnesses, we have cleared any barriers to access for those treatments. Oh, and yes, I'm being reminded, one of the biggest things you can do is wash your hands. And again, kind of common sense things, cover your cough, let's go back to the kindergartners and what we try to teach our children. A large part of our efforts here with school closures and all of the things we're doing, given that we haven't had any positive cases in the area, is to try to, keep things under control. That, if we have kind of a rapid, buildup of cases because, we are all over each other, that's going to really strain our resources in terms of providing supporting care. So the goal with, having people stay at home and follow kind of common sense procedures is hopefully to slow that incidence of illness so that the folks that most need, serious care are able to obtain that.
Excuse me, you said treatment's covered and testing's covered, and you were talking about Oregon Health Plan?
Oregon Health Plan, and then I know for Medicare, our Medicare product, but Medicare in general, those are covered.
All right. Thank you very much. Are there any other questions? Yes, sir.
Again, for Sherry, I'm the education reporter, so that's why. But does the district know if any students or staff have been tested for the virus?
So I'd like to actually add something to that, because there's a question that came into our office. Is there a potential for extending the school year to make up for lost time?
Okay. So, no, I don't know if anyone has been tested. That is either a student, a staff, or related to a student or staff. And so your question about?
Potentially extending the school year.
That's always a possibility. So like when we have snow days, there's a certain number of days that we can take, but we can also build back in. Right now we can build back in 2 days, and that is all governed by our collective bargaining agreements. So if this became an extended closure, we would definitely have to, go back to the bargaining table with our employees to determine how many days that we would extend the school year, unless, of course, the governor makes a proclamation and nobody has an option but to extend the school year, and they tell us how long that would be. So, yeah, there's always the opportunity to do that.
Okay. Sorry, but I knew that question would come up eventually. So, are there any other questions? If not, we can go ahead and wrap up. I will remind everybody, of course, please wash your hands, use hand sanitizer when you can't, and if you are sick, do not go to work or school if at all possible. Thank you. Thank you very much. We'll continue to put information out. We encourage you to follow Josephine County Public Health on Facebook, as well as the county page, social media pages. We'll be continuing to put out information regularly. Coming up, we'll be putting out quite a bit of information around what businesses can do to support themselves, their customers, and as well as their employees. So, thank you all very much.